Kaposi's sarcoma is a type of cancer that forms in a lining of blood and lymphatic vessels, often appearing as purple, red, or brown skin lesions. It is most commonly associated with immune system suppression, especially in people with HIV/AIDS. Kaposi's sarcoma (KS) can also affect internal organs, such as the lungs and digestive tract. Types of Kaposi's sarcoma: epidemic AIDS-related Kaposi's sarcoma. Most common, found primarily in people with HIV/AIDS. KS became well known as an AIDS-defining illness. HIV connection, linked to immunosuppression due to HIV, often progressing rapidly if untreated. Highly active antiretroviral therapy (HAART) treatment for HIV has reduced the incidence of KS by boosting the immune system. Classic Kaposi's sarcoma. Older individuals, typically affects older men of Mediterranean, Eastern European, or Middle Eastern descent. Slow progression, generally less aggressive and often limited to skin lesions on the legs and feet. Endemic African Kaposi's sarcoma. Sub-Saharan Africa, common in parts of Africa, especially in people not infected with HIV. Children and adults, can affect both adults and children, with varying severity and progression. Iatrogenic transplant-related Kaposi's sarcoma. Immune suppression, occurs in people who have received organ transplants and are on immunosuppressive drugs. Reversible. Reducing immunosuppression can help manage or reverse the condition. Causes: Kaposi's sarcoma is caused by infection with human herpes virus 8 (HHV8), also known as Kaposi's sarcoma-associated herpes virus (KSHV). However, not everyone infected with HHV8 develops KS. It typically occurs in individuals with weakened immune systems, such as HIV/AIDS. Immunosuppression caused by the virus increases the risk of KS. Organ transplant recipients, immunosuppressive medications increase the likelihood of developing KS. Genetic predisposition, certain populations, particularly those of Mediterranean and African descent, have a higher risk. Symptoms: Kaposi's sarcoma often manifests with visible skin lesions, but it can also affect internal organs. Skin lesions: purple, red, or brown spots, painless, flat, or slightly raised lesions that may appear anywhere on the skin or mucous membranes. No itching or pain, usually asymptomatic, but lesions can ulcerate or bleed in some cases. Internal lesions. Lung involvement. KS can cause coughing, shortness of breath, and chest pain if it spreads to the lungs. Digestive tract involvement may cause gastrointestinal bleeding, abdominal pain, or blockages. Lymphatic system involvement. Swelling. KS can block lymphatic drainage, leading to swelling in the legs or face. Diagnosis. Diagnosis typically involves a combination of physical examinations, imaging, and biopsies. Physical examination. Skin lesions. Physicians may visually inspect skin lesions, but a biopsy is usually required for confirmation. Biopsy. Tissue sample. A biopsy of the affected skin or organ tissue is analyzed to confirm the presence of KS cells. Imaging studies. CT scans or X-rays, used to detect KS in the lungs or other internal organs. Endoscopy. Gastrointestinal involvement. If KS is suspected in the digestive tract, an endoscopy may be performed to visually inspect the area and obtain tissue samples. Treatment. Treatment for Kaposi's sarcoma depends on the type, extent of the disease, and the patient's immune status. It may include the following options: antiretroviral therapy (ART), HIV/AIDS. The most effective treatment for AIDS-related KS is antiretroviral therapy to suppress HIV, which can also shrink KS lesions by improving immune function. Local treatments. Surgery. For isolated skin lesions, surgical removal may be an option. Cryotherapy. Freezing lesions can help reduce their appearance. Radiation therapy. Useful for localized lesions that are painful or bleeding. chemotherapy, systemic chemotherapy, for widespread or internal KS. Chemotherapy drugs such as liposomal doxorubicin or paclitaxel may be used. Topical chemotherapy may be applied to skin lesions in some cases. Immunotherapy, interferon alpha, and immune-boosting therapy sometimes used for KS, particularly in people with less severe immunosuppression. Adjusting immunosuppressive drugs. Transplant recipients. Reducing immunosuppressive medication can help in managing KS for transplant patients. Prognosis. The outlook for Kaposi's sarcoma varies based on the type of KS, the extent of the disease, and the patient's immune status. With early detection and treatment, many patients, especially those on antiretroviral therapy for HIV, experience good outcomes. However, for more aggressive forms or when internal organs are involved, the prognosis may be more guarded. Conclusion. Kaposi's sarcoma is closely linked to immune system suppression, particularly in people with HIV/AIDS. Advances in HIV treatment have significantly reduced the incidence and severity of KS in affected individuals. Treatment focuses on managing the underlying immune deficiency, controlling the growth of lesions, and addressing any associated complications.